First, our state has had one of the highest suicide rates in the nation for many years now. Many organizations are working to address this issue. Help can start with a phone call. Producer Sarah Gustava sits down this week with a crisis support line manager to learn more about resources that are available for people who want to reach out for assistance for a loved one or themselves.
Wendy Linnebrink Allison is the program manager of the New Mexico Crisis and Access Line and Peer-to-Peer Warm Line. Thank you for stopping by today.
Thank you so much for the invitation. I appreciate being here today.
There are so many ways that people can connect with other people when they need support, email, text messages. Why is a phone call still an important resource for people who may be struggling and thinking about hurting themselves?
Well, when you make a phone call and you're talking with one of our counselors, we're able to build rapport with you and we're able to find that connection. And sometimes that's just not as easy to attain when you're text messaging or online or something.
Yeah, but you guys are offering some text messaging services for people who want that.
We are. We know that there are some people out in the community that feel more comfortable communicating on websites and social forums such as that. And texting is big within our younger population and our homeless community. And so we do offer texting on our peer-to-peer warm line.
Okay, it seems like there's a generational difference there maybe.
Well, in some cases, yeah.
Okay. How do the people answering the phone provide support to someone? What happens when a call comes in?
So when a call comes in, we find out what you're calling about and ask you what's going on and try to meet you where you are and understand what you're struggling with, because you know what, in that moment when you are reaching out for support, sometimes you don't honestly know why you're reaching out. You just know that you needed somebody to talk to. And that's what we're here for. We're just here to hear you in that moment. So when you're calling us, the questions that we ask you are, you know, about what's going on. Has there been anything that has happened recently that helped make you feel this way? Have you talked with anybody else about this? Who's your support system? Have you engaged your support system recently? So, you know, when people call us, we just make sure that we are looking at them as a whole and trying to help them out in those moments.
Do you find that some people do reach out on the line to a stranger that they feel almost more comfortable with that than someone that they know? They haven't been telling people they know what's going on?
I do. I think that it's sometimes easier to talk to somebody that you don't know than it is to talk to your friends and family members who want to sway you one way or another. And having somebody to talk to that doesn't have a personal relationship with you sometimes makes you feel safer.
Yeah. And how do you prepare those people who are answering the calls for what might be coming in?
Well, we are really proud of the program that we have. All of the counselors that answer on our crisis line are actually trained professionals with their master's degree or higher. And on our peer-to-peer warm line, they are people with lived experience in recovery from their own mental health diagnosis that are certified peer supports through the State of New Mexico Office of Peer Recovery and Engagement.
Okay, so who would call to each line? Where are you directing folks?
So it's choice by the caller. So you can call either the crisis line or the warm line. The benefit of having an integrated program is if you call the crisis line and you might really benefit from talking to a peer support worker who has walked in similar shoes as you, then we might suggest, maybe next time you might want to call the peer-to-peer warm line, or would you like us to transfer you to the peer-to-peer warm line? And vice versa on the warm line, if somebody might be struggling and they might appear in crisis, but they didn't realize they were experiencing concerns that are potentially putting them at risk of harming themselves or somebody else, then we would ask them if it would be all right if we can transfer them over to the crisis line. And so you can call either line, but the people that are calling the crisis line are the ones who, are at risk of hurting themselves or somebody else, or are worried about calling in order to see how to help somebody else. And they're calling to say that, my loved one is experiencing some thoughts of suicide or a homicide or is in a domestic violence situation, and how can I help them?
How do you get the word out to people that these resources are available?
We do a lot of partnering in the community, and we do a lot of collaboration with other providers, alliances, coalitions, and community members to spread the word, because we know that it's so important to get that word out there, and we know that the only way to make a program successful is honestly word of mouth. And so we go to health fairs, we go to schools, we go to providers, we go to libraries, and we put posters up. We talk about our program. We do trainings about why you would want to call the crisis line. We do trainings like mental health first aid or QPR suicide prevention about how to look for signs and symptoms and how to persuade somebody to stay alive.
I've been really interested in that concept of mental health first aid. What does that look like?
So it's an 8-hour training curriculum that is offered to the community, and we teach you the ALGE algorithm, which ALGE stands for Assessing for Risk of Suicide or Harm, Listening Non-Judgmentally, Giving Reassurance or Information, Encouraging Appropriate Professional Help, and Encouraging Self-Help and Other Support Strategies. Because when you are living in the world, then you're the one that might recognize somebody is struggling. You know, people don't honestly reach out when they're struggling and say, hey, I'm struggling, can you help me? So it's up to you and I to recognize that they're struggling and reach out to them and say, I care and I notice something's going on and I'm wondering, you know, if you want to talk to me, and if you don't feel comfortable talking to me, would you feel comfortable talking to somebody else? And there's this great resource called the New Mexico Crisis and Access Line that you can reach out to if you don't feel comfortable talking to me, or if I'm not available when you need support.
Because I think some people, they want to help, but they feel really nervous about making that first step and talking to someone and saying, I see you struggling, I'm worried about you. Mm-hmm. Absolutely. Now, this makes me think about the very, we're a very big state, a very, not very densely populated state where people are out on their own. Is this part of reaching that need as well, of people who might be geographically isolated in our state and struggling?
Yeah, so in 2011, House Joint Memorial 17 was passed, and what it did was create a task force to identify where are the gaps in our system. And the task force developed an outline that said, we live in a rural and frontier community, and we need something that people can access in the moment and get them the right care at the right time. So Behavioral Health Services Division was able to find funding to build the New Mexico Crisis and Access Line and peer-to-peer warm line. And we have been around for 5 years now and are happy to be providing these services. But what it does is it offers people that support when they don't feel like they have anybody, or where services are hours away and they need somebody to talk to right now. And so that's what the Crisis and Access Line and peer-to-peer warm line offer.
Now, what about efforts to innovate and advocate for solutions to address particular communities' needs? Say there was some concern about suicides at the Rio Grande Gorge Bridge up near Taos. Are there ways to come into a community and do some specific work that addresses what's going on there?
Yeah, so the Department of Transportation was able to install intercoms on the Rio Grande Gorge Bridge, and those intercoms do reach out to our program, and our counselors are the ones that are talking to people who push those intercom buttons to reach out for support in the moment that they need somebody to talk to. And we are saving lives as a result of having people have somebody to talk to in that moment that they're contemplating things. And Taos isn't the only community that we're doing reach outs to. We do live in a very rural and frontier community, and so I will travel throughout the state talking to people about what's going on in your community and how can we support you, and what is it that your community is experiencing right now. And like in some place like Espanola and Rio Arriba County, they have a high concern of heroin and opioid use, and so we are part of the STR grant with BHSD that helps people understand that there is naloxone available for people to reverse opioid use disorders, and there is programs available, and so we can connect you with a program because we are an intervention at the Crisis Line. And the intervention that we offer is not just helping somebody in that moment, but reminding them to connect to resources beyond the call. So we work with community partners to find out what resources are in each community. And then when callers reach out to us, we're able to refer them back into the community to get additional support beyond the call and build a therapeutic relationship, either with a professional provider or with their support system.
Yeah, maybe a group. It sounds like we're making this transition into talking about this as a community issue, not just about an individual or a family, but a community. Do you think that will change how we approach suicide prevention?
Well, geez, I sure do hope so. I think that suicide is the most preventable disease out there, and that when we look at suicide or substance use or mental health in a way that it's understanding that it is a diagnosable disease and that we need to treat somebody experiencing these things the same way we would treat somebody experiencing any physical health disease like cancer or the flu or asthma, and give them empathy instead of sympathy and reduce those stigmas and let people know that I understand you're struggling and I care enough to help you out and support you while you're trying to heal.
Wendy, thank you so much for stopping by and talking about these resources. We will put links on our website and keep track of the work that you continue to do.
Well, thank you so much. It was great talking to you today. I appreciate the invitation.